Hey guys, what is up? Dr. Joanne Michelle Martin here from JMM Health Solutions, and today I want to talk to you guys about something that affects a lot of women when they're pregnant. It can affect them after they've had their baby. It is annoying, it is uncomfortable, and it can be a downright pain in the ass, pun intended. What am I talking about? Hemorrhoids. So oftentimes people are not even aware that this is a problem that they can get when they're pregnant. A lot of women will complain of burning, itching, stinging, either while they're having a bowel movement or even after, and a lot of pressure in that area. One of the reasons, or a few of the reasons why this happens, is because when you're pregnant, you have an increased amount of progesterone in your body. That's a hormone. And what that does is it helps to relax some of the vessel walls. So your veins are vessels and they're more relaxed and they're prone to swelling. The other thing is that as that baby grows, there is a lot of increased pressure in the pelvis. And coupled with that, you also have an increased blood supply because, hey, that baby needs nourishment. So you put all these things together and it creates a really, really nice solid recipe for hemorrhoids. A lot of the times, women are continuing to do their normal daily activity, which may involve a lot of standing, like if they're at work, or a lot of sitting, again, if they're at work, or, their normal day-to-day activities. And we oftentimes don't think about that, but these prolonged positions can cause a lot of increases in pressure, and that can make the problem a little bit worse. And then the other culprit, constipation, which affects about 40% of women when they're pregnant, and I'll save that for another video. So what the heck do we do? Like, seriously, what do we do? So I've got a few tips and tricks that I like to share with my moms for things that they can do if they are dealing with hemorrhoids. You ready? All right. Number one, you have to increase your fiber intake. You have to increase your fiber intake. Vegetables are your friends. If you can't eat them, then drink them. Blend them up in a smoothie, something that's a little bit more palatable, but make sure you're getting your fiber. That will help to alleviate the constipation. Number two, squatty potty. What a squatty potty is, and I should have brought mine. I'll take a picture and send it for you guys and post it below this video. But a squatty potty essentially is just, think of how little kids go to the bathroom and they have that stool under their feet. They put their feet up. What that does is it brings the knees above the hips and it increases, this is the technical jargon, it increases the anorectal angle. Basically, it puts you in a better position to poop. It makes the poop easier to come out. That way you don't have to strain. Because if you're straining and you've got swollen veins, then that's going to cause increased irritation, and we definitely don't want that. Water. H2O, people. You should be drinking half your body weight in ounces. If you weigh 150 pounds, you should be drinking 75 ounces of water a day, at least, okay? So make sure you're drinking your water. Number four, if you are dealing with hemorrhoids, definitely try to use something that's less irritating. So instead of using toilet paper, one suggestion is use flushable wipes. It helps to keep the area clean, but it's not as irritating. It's not as rough as regular toilet paper. And so a lot of moms tend to find comfort with that. Sitz baths can be helpful. Just, go take a nice bath, relax. It can help to add some soothing to that area. And coupled with that, a cold compress. So if you're hurting, if it's uncomfortable, you can either use a cold compress, or one of the other tips and tricks that I share with a lot of moms is a witch hazel compress. So you get a sanitary pad and you put witch hazel on it and you put it in the freezer so it gets cold, and you put that on your pelvic area, your perineal area, or like the crotch of your underwear. And that way it gives that cool feeling, and it helps to decrease any inflammation that you may have in that area. Again, you want to avoid prolonged standing. You want to avoid sitting. You want to move as much as you can. So move. All right. If in cases of, and I'll talk about this again in another video on constipation, because like I said, 40% of women deal with it. If fiber is, you're not able to get enough fiber, or you've been taking supplemental fiber and that's not been helping, you've been drinking your smoothies and that's not been helping, talk to your OB because you may need something else. I tell women, try a stool softener. Do not take a laxative. Laxatives are going to cause dehydration. It's going to send you to the bathroom. You might end up with diarrhea and you're going to have dehydration. You don't want to be pregnant and dehydrated, okay? So try those tips and tricks. If you are listening to this and you're a birthing professional and you've got some additional tips and tricks, please share them with our moms. Again, this is a community, and whatever we can do to help our moms is amazing. So again, I'm Dr. Joanne Michelle Martin from JMM Health Solutions. And if you've got any questions, leave me a comment below. Take care.